We are live. We are live. Welcome to Medical Monday. I'm Dr. Frita, and you know I have a whole lot of hot health topics in the news for you. Today, we're going to start off with my favorite game, Myth versus Fact, and we will talk about the tennis phenom, Venus Williams, and how she has literally been battling with fibroids, which she states affected her tennis career. And so we'll talk about myth versus fact when it comes to fibroids, details you need to know. And then, of course, we'll get into your weekly dose where I'll give you a fresh take on the medicine in the headlines that you simply can't get anywhere else. We'll start off talking about diabetes because pre-diabetes is on the rise in our youth. Yes, young people, preteens, adolescents, it's on the rise. And so we'll talk about the significance of that and how to recognize signs and symptoms of diabetes and what you can do in your kids to stop this, not so great phenomenon that's occurring. Next, we'll talk about something really amazing. In Prince George's County in Maryland, we have a brand new fire chief. And while she was standing and presenting herself in front of everyone, boom, she passed out. Yes, she did. And so we'll talk about what to do when someone passes out, what it can mean, and how to help in the right way and not hurt them while trying to help. And then let's talk about NeNe Leakes. Y'all, it's no secret that I'm a Real Housewives of Atlanta fan. I'm a NeNe Leakes fan, and she has been going through a whole lot. We've talked about it here before, that her young son, Brentt, had a heart transplant and a stroke. Well, now she's giving us updates because he's been hospitalized because his heart transplant is showing signs of rejection. So what we'll do is we'll talk about strokes, we'll talk about heart disease, heart transplants, and we'll talk about signs, symptoms, prevention, and just things you really need to know. Lastly, I'll give you your 5-minute health check where I'll just run through things that are being recalled, certain infectious disease health updates. And of course, we're live. I'm Dr. Frita. We'll interact. You can ask me questions, and I'm asking you questions too. So let's go ahead and get started. I'm Dr. Frita. This is Medical Monday. We're going to have a great show. Welcome, welcome. We are live. I'm Dr. Frita. This is Medical Monday. Let's get this thing started. You know I'm not doing it alone. To my co-host and office manager, Shador. Come on to the front of the stage. Hey, Shador, how you doing?
Good. How are you, Dr. Frita?
Doing pretty great. How was your week?
Uneventful, to say least, but relaxing. Now I'm just trying to catch up.
Relaxation is good. Catching up is not fun. I had a great week. I actually went to the Run for the Roses basketball girls tournament where it was my daughter's first time with this travel basketball team getting to go to this conference. And I didn't realize that it's actually the largest, I believe, if not one of the largest. I think it's the largest youth AAU girls basketball tournament. Dawn Staley was there. Ja Morant was there. It's like a really big deal. And so she and her team competed with Wood Elite. And, they made it to the championships. They were 4-0 at that point and didn't quite take it all the way. Came home second place. Great learning experience. I'm very, very proud of her and the whole team. And I'm proud of the coaches because let me tell you, the coaches and the trainers, they won't allow us parents to fuss. I ain't like what the ref was doing, or I didn't like this because, we like to fuss. The coaches will tell the girls, okay, yeah, all that's true. But if y'all made all your layups, if you made all of your free throws, we wouldn't be having this conversation. And so they always take it back to the accountability of the team. And for those of you watching in the chat, I put a little something on IG. I did an IG live while I was out there on anxiety in children when it comes to sports. Okay. Performance anxiety in youth sports, how to recognize it and how to cope. And parents, how for us to hush our mouths on the sideline so we don't worsen our kids' anxiety. So check that out on IG after today's live. Shador, who's the first person in the chat today?
First person in the chat today is Purple Onion. Hello.
Purple Onion, Purple Onion, Purple. Hey, thank you for being here.
Yeah. All right. And shout out to our member joining us today, Andrea.
Hi, Andrea. Thank you for being a member. For anyone else who wants to join the membership, come on over. You get different perks. Of course, you get custom emojis. I give you members only videos. You get first peek when I'm releasing some of our new YouTube videos. And of course, we have our members only live Q&A sessions. And for those of you who are new to me, I am Dr. Frita. I'm an MD. I'm a medical doctor who has been board certified in nephrology. So I'm a board certified kidney doctor and high blood pressure doctor. I've also been board certified in internal medicine, pediatrics, obesity medicine. And so I like to talk a lot about a lot. And so if you're a member at the certain tier, then you can have interaction with me where you can ask me whatever questions you want, and you can access all of this good old learning that I like to do. So thank you, Andrea. Thank you for being a member. Purple Onion, thank you for being the first one in the chat today. All right, let's get this thing going, Shador. Let's start off with my favorite little game, myth versus fact. Myth versus fact. So, you know, Venus Williams, who's a 7-time Grand Slam winning tennis phenom. And of course, we know her sister, Serena Williams. So Venus is the older sister who got this thing going. We knew that she was diagnosed with an autoimmune disease. Maybe some of you knew, some of you didn't. She has something called Sjogren's. And so there were times throughout her career where she's been ill just due to the chronic illness of Sjogren's disease. And now she shared that she also has fibroids. And she said that her fibroid diagnosis and the symptoms were dismissed for years. She would be in debilitating pain, have anemia. And at one time, she was even passed out on the locker room floor right before a Wimbledon match. And so it's really been a big deal. And now she's talking out about fibroids to try to educate people about them. So I first want to play our little game. Do I want to play our little game first, or do I want to watch the clip first? We'll watch the clip first and then get your pencils out because we're playing myth versus fact after this clip.
You believe fibroids impacted your career?
I believe definitely fibroids impacted my career. I never had enough energy most times to play a real match the way I wanted to. And of course it affected my results.
You're one of the top athletes in the world. You have the best medical teams, and yet you still didn't have clarity on what fibroids meant for you. Why do you think it took so long?
No one knows that this is an issue. There is no one talking about it.
All right. That's really interesting that she said that, because I certainly believe it, especially when you hear now all of the symptoms that she had from her fibroids. No way can you be on your tip top performance if you're having these symptoms. But Shador, let's go ahead and get going with the myth versus fact statement number 1. So everyone who's here in the chat, put an M1 if you think this first statement is a myth, and F1 if you think this first statement is a fact. All right, let's see it.
You can have multiple fibroids at the same time, each causing different symptoms.
You can have multiple fibroids at the same time, causing different symptoms. Put an M1 if that's a myth, and F1 if that's a fact, Jack. All right, myth versus fact statement number 2.
Surgery is the only way to treat fibroids.
Okay, surgery is your only option. M2 if you think that's a myth, F2 if you think that's a fact. Pencils down, pencils down. All right, let's get into these answers and then we will talk about fibroids. Let's see here.
All right. Statement 1, you can have multiple fibroids at the same time, each causing different symptoms. Let me have a mixed bag on this one, Dr. Frita.
All right.
KT, hello.
Hi,
Says
KT.
it's a fact.
It's a fact. So you think it's not just one fibroid at a time? You can have multiple ones at the same time causing different symptoms. All right, KT, we'll see.
I can see clearly. Hello. Says it's a fact.
It's a fact. I can see clearly now. All right. We'll see if you're right. I can see clearly now. So you think it's a fact. All right.
Chatting with Elise. Hey. She says, chatting with Elise.
Hey, good to see you. We haven't seen you in a little minute. Chatting with Elise. Okay. So you think it's a myth. You don't think you can have a whole bunch of fibroids doing this, doing that, causing multiple symptoms. All right.
Marina, hello, says a
Hi, Marina.
fact.
A fact. All right, Marina.
And Lisa, hello, says a fact as well.
All right, you think it's a fact, Lisa. All right. The answer is it's a fact. It's a fact. You can have multiple fibroids at the same time causing different symptoms. And the thing about fibroids, they can range from being the size of a pea to being the size of a football. Okay, very seriously, they can be huge. And what a fibroid is, or a leiomyoma, is it is a benign, okay, non-cancerous, non-malignant. It's a benign growth of muscle tissue or muscle cells in the uterine walls. Okay. And so you can have them where they are protruding into the inner walls of the uterus or womb. Okay. Which of course could affect things like fertility. Okay. They can be pressing in the back of the uterine wall. And let's take a look at one of those photos, Shador, if you have it, of what a bunch of fibroids in the uterus might look like. Okay. So that's one where on the kind of darker side, that blue-gray side, a normal side of the uterus, and then you have fibroids on the other side. And in this picture, so right in the middle, that pear-shaped organ is your womb or your uterus. Heading down in the picture, you'll see that's where it goes through the cervix and into the vagina. And then those two things that look kind of like ram horns are the fallopian tubes. And then you have your ovaries, the eggs hanging on the end. So the uterus right there in the middle, that kind of upside down pear, is where the fibroids are. And on the right side, where there's like kind of red and orange, that's where the fibroids are. And you can actually have multiple fibroids at the same time. Shador, can you pull up that other photo that has like a bunch of different fibroids? Okay, so here you can see where you have different fibroids, different sizes, different kind of places within the womb. And you can imagine if you have a fibroid that's in the front of your uterus. So let's talk about anatomy and the way things are. If you kind of put your hands below your navel, kind of where your bladder is, and you know what the bladder is because you know when it feels full, when you have to use the restroom. Well, right behind the bladder is the uterus. And so you can imagine if you have a fibroid that's kind of right there touching or pushing on the bladder, it can cause certain bladder symptoms, right? And then behind the uterus, behind the uterus is the rectum. So you can imagine if you have a fibroid that's back there, it could cause issues with constipation or things of that nature. So depending on where the fibroid is located, you can have multiple fibroids, different sizes, different places, causing different symptoms at the same time. So that's why that statement is a fact. As we move into our next question, I want y'all to put in the chat different signs and symptoms and complications of fibroids. And so we'll touch on that. Meanwhile, let's pull up myth versus fact statement number 2.
Surgery is the only way to treat fibroids.
Surgery is the only way to treat fibroids. All right. Who said
this one also?
Okay.
Excuse me. So we have Regina.
Hi, Regina.
That's a fact.
It's a fact. The surgery is the only way to actually treat the fibroids. Okay.
KT says a myth.
Hi, KT. Myth. You think there are other options other than just invasive surgery, KT? All right, KT.
Bologna. Hello.
Who is this now?
Bologna.
Hi, Bologna.
Says a myth.
A myth. So you think there are other options than just surgery? All right.
Sherry says a myth.
Sherry says it's a myth. All right. All right.
Paula. Hi, Paula. Says it is a fact.
It's a fact that if you want your fibroids treated, then surgery is your only option. All right, Paula.
And Nick Nack says it is a myth.
Nick, Nack, Patty, Whack, okay, so you say that it's a myth, that there are other options other than surgery. I'm actually very happy to see that we have a mixed bag, not because I just, like tricking people, but also because that lets me know that there's a place for learning here. So myth versus fact, surgery is the only option to treat fibroids. This is a myth. It is an absolute myth. But as we can see by our mixed bag in the answers, a lot of people think this is the case. So for me as a physician, I take care of so many patients. And Shador, you see them when they come into the office. I'll be doing the, history, and I'll find out that they've had a hysterectomy, or a removal of the womb of the uterus. And especially for my ladies who were born like before 1965, I noticed so many of them have hysterectomies. And I say, oh, why was your uterus removed? Do you have cancer? Did you have something, really? No. I say, why? They say, oh, fibroids. I'm like, oh, okay. Okay. And I find that many women, and many Black women to be specific, have had fibroids, and that has been presented as the only option for treatment. They've had surgery to remove their whole uterus. They've had hysterectomies as a treatment. And oftentimes I find that they could have had other options. Fast forward to now, right here in modern days, and Venus shares this in her story. She said that one of her doctors talked to her about having a hysterectomy as if that were the only option. And of course, she was her own advocate, and she found that there were different options other than just having a hysterectomy. And so ultimately, that's what she did. She had a surgical procedure, but not a hysterectomy. So let's talk about some of the options. So if you are having fibroids, and we'll get into some of these symptoms. So yeah, make sure you're putting down the symptoms of fibroids. One thing that can be done, there can be hormonal treatment, because we know that the more estrogen that you have, the more estrogen that your uterus is exposed to, oftentimes that increases your risk for having the fibroids. So hormone therapy is an option. Won't work for everyone, but it's certainly an option. And then there are non-invasive procedures like uterine fibroid embolization. That's a procedure that's done by a radiologist. Literally what they do is they put in a catheter, like a small tubing, almost like an IV. They put in a catheter, usually in the groin, and they thread the catheter to find the arteries that supply the fibroids. Mm-hmm. And then they put a material in there, they inject a material that literally blocks off the blood supply to the certain fibroids. This causes the fibroids to shrink, okay? And then it decreases your symptoms, all without having surgery. Literally, a radiologist can do this, but many people aren't aware that this is even an option. Even today, some women they take you straight to hysterectomy. And so you really have to be aware, and you have to advocate for yourself, as Venus did. And, we talk about health disparities, Shador, and so many people think that, okay, health disparities and the fact that the black maternal mortality is like 3 times higher than women of other ethnic groups. They think that it's only if you are, of a low income or some type of a socioeconomic decline, something like that. But even people like Venus, and Serena has shared certain stories as well. It doesn't matter where you are in your station of life or your wealth or celebrity. Sometimes, very often, there are racial disparities in care, and even Venus experienced that. Because why are you offering her a hysterectomy without offering her the other less invasive options? Okay, so uterine fibroid embolization, hormonal therapy. There's also something called a myomectomy, where it's a surgical procedure, but in this procedure, the fibroids are individually removed from the uterus, and the uterus is left intact. And that gives you the option of still carrying a baby without having the fibroids, okay? So it's not a hysterectomy. The fibroids can be removed surgically, and your uterus can be left intact. This is a myomectomy. And of course, the hysterectomy is indeed one option. And for some patients, it is indicated, okay? But just make sure that you have the conversation with your doctor. And if you don't feel comfortable with your treatment options, get a second opinion. And that's the whole point in us doing these talks, doing these medical lives, and me doing videos, is so that you know what's out there so you can advocate for yourself. And again, for those of you who are new to me, I'm Dr. Frita. And right here on the YouTube channel, I'm so proud and thankful to say that we now have over 880,000 subscribers. Okay, we're marching toward 900,000. We have hundreds of videos with evidence-based medicine so that you can educate yourself, share these videos, educate others, and you can be your own advocate for your health. All right, Shador, did anyone list any symptoms of fibroids?
Yes, we have some similar comments. Marina chimed in.
Hi, Marina.
With heavy bleeding during menstruation and pain.
Absolutely, absolutely. And Venus Williams shared that she had that. Can you imagine standing in front of the world to do a tennis competition? You sit up here just heavy bleeding, and that can lead to anemia. And yes, you can have severe pain. Absolutely.
Yeah. Nick, along with those same two, she added cramps.
Yes, cramps. Not even just run-of-the-mill cramps, but debilitating, severe cramps that will have you lying on a locker room floor, like with Venus. Good.
Gospel fan.
Hey, Gospel fan, welcome back.
Gospel fan said you can change your diet to stop feeding the fibroids.
Well, there are some theories, and as I mentioned, high estrogen in some cases. Well, we know that can increase your risk for fibroids, so that could be an adjunct treatment. Certain diets. You always want to consult with your doctor, not only your general doctor, but your gynecologist, as far as the management of the fibroids. Good.
Elonia added tiredness to the list.
Yes, not even just a little bit tired. Imagine if you're losing just high amounts of blood when you're having your periods, and that can certainly lead to anemia and tiredness and fatigue. Yes.
Yep. Regina.
Hi, Regina.
Nausea and irregular cycles.
Yes, you can definitely get irregular cycles. Instead of your period lasting maybe 5 days, 7 days, it might last 10 days, 15 days, 21 days. Then it might disappear for a while. It might come back. And yes, you can get nauseated. And, and there's other GI symptoms or gastrointestinal symptoms. When I say gastrointestinal, GI, I'm talking about symptoms that involve like your stomach, intestines, your esophagus, which is that tube that connects your throat to your stomach. So when I say GI symptoms, I'm talking about your digestive system. So in addition to nausea, you can get constipation, because I mentioned that if you have a fibroid that's in the back of the uterus, well, your uterus is right in front of the rectum. A big old fibroid can have you blocked where you're not having proper bowel movements. Yeah.
All right. Those are all the symptoms listed. NeNe did ask, should fibroids be removed before putting an IUD or before getting an IUD?
Not necessarily. I will say though, NeNe, that's one thing that I would consult with your gynecologist, the specialist in doing those surgeries. And so it's going to be a case by case basis, but that's definitely something you would want to consult with your doctor about, because as we mentioned, different people can have different sized fibroids. The same person can have different sized fibroids. So on one person, the location of the fibroid could be an issue. In another person, it could be a tiny pea-sized fibroid that's somewhere on the outer wall. That's not an issue. So I would definitely consult with your doctor.
All right. Thank you, Dr. Frita.
Okay. Some other symptoms. I think we did hit on most of them. The anemia, the fatigue, problems with constipations, bladder issues. Okay. You can have difficulty emptying your bladder if the fibroid is in the front of the uterus, pushing against the bladder. Okay. You can have an incomplete sense, of emptying the bladder. You can also have problems with fertility. So that's the big one, right? Where because of the way that the fibroids are distorting the lining of the uterus, it can make it difficult for an embryo to implant. It can make it difficult for you to either get pregnant or difficult for you to keep the pregnancy and carry out a full pregnancy. But again, hysterectomy is not the only option for treatment. You can have myomectomy, hormonal treatment, uterine fibroid embolization. The point is to consult your doctor. If you're not comfortable with the options, at least get a second opinion. If 2 doctors, 3 doctors all say the exact same thing, then hey, perhaps that's the answer. But understand that getting a second opinion is not an insult to your doctor. It is your right, and it is your duty to yourself to maximize your health. All right. Make sure that after you finish watching this live, you check out some of the short form content I did. I have it on IG, Facebook, TikTok, LinkedIn, where I did a short video on fibroids. I think it was 7 things you need to know. It's just a nice, easy to digest piece of information and something for you to share with people. Because another complication that people don't talk about that much is the social complication, the humiliation of the heavy bleeding, and sometimes bleeding through your clothing, even when you have on proper feminine hygiene garments. And so that can really be socially debilitating. It'll keep women from going to pool parties, keep women from wearing white, keep women from wanting to be out away from the house. It's a big deal. So yeah. And another point, fibroids occur in up to 80% of women by the age of 50, and Black women are disproportionately affected. We're up to 3 times more likely to have fibroids, and they are often diagnosed at younger ages than in women of other ethnic groups, and we tend to have more severe symptoms. So just the more you know, the more you grow. And yeah, so that's the story on fibroids. Anything else?
Yeah, before you move on with that one, Regina, she said, can you mention what can cause the fibroids?
Yeah. So the thing is, Regina, we don't have all of the answers. We know that oftentimes if you have a first degree relative, a mama, a sister with fibroids, then you're more likely to have them. We also know that high estrogen, okay, if you're a woman and you have high estrogen, then you will have high fibroids, a higher chance of fibroids. And one of the things that correlates with that fact is that Oftentimes, women who are post-menopausal, okay, when the estrogen starts to come down, their fibroids will start to shrink. Fibroids are less of a problem when you have less estrogen. Some studies will show us that being a person living with obesity, or if you're living with being very overweight, that could put you at high risk for fibroids as well. And as I mentioned, just Black women in general, for whatever reason, tend to have fibroids diagnosed at younger ages, and we're more likely to have the fibroids. So while we don't know all of the exact causes, we do have those correlations, and we know that the fibroids or fibroid tumors are benign. They're not cancerous, and it's literally is abnormal growth of those muscle cells in the walls of the uterus.
All right. Thank you, Dr. Frita.
All right. Thank y'all for that good old participation. Yeah, make sure you share that and give us a like, please, as you sit up here and join us on this good old Medical Monday. Give us a like, give us a share. It's a free way to support the channel. It lets YouTube know that we're here. We're here. Get used to it. And something else I want to tell y'all as we get ready to move on to our weekly dose. I had a good time this week because I was on a very exciting show. I am the newest co-host for Truth Talks Live. And if you click the link in the description here on YouTube, you can check out my segment. If you fast forward to 25 minutes, that's where I am, but the entire episode is good. On Truth Talks, I am there. I'm a co-host with the pop icon Touré. Okay, I'm sure you've seen him. He has his own show. He's been on CNN. He's been around for decades and very heavy in pop culture. And we also have the viral Dr. Cheyenne Bryant. I know y'all have seen her. And see, she was recently in a conversation with NeNe Leakes. I believe it was on the NeNe Leakes show. She also really became worldwide with her interview with Cam Newton. Okay, so Dr. Cheyenne Bryant, she's a host of the show as well. And also, y'all know I've been on the Emmy Award-winning Fraternity Court with with Judge Lauren Leakes. Judge Lauren Leakes is a co-host of the show, and so she's on the episode with me as well. And this is the rise and fall of Diddy. There were a couple parts to this episode. I was talking about the medical mystery. I was talking about, from a medical perspective, what I think about Kim Porter's being unalive, about Al B. Shore and his multi-organ failure, needing a liver transplant. I talked about Cassie with mouth sores and UTIs. So make sure, click the link in the description, check out that segment, and just put something in the chat, please. Tell them Dr. Frita sent you. That would really be wonderful. I really need your support. So just check out that video. Help me out. I appreciate the support. I want them to know that the med heads show up and show out. So I appreciate y'all for that. But click the link in the description. All right. Now it's time for your weekly dose, good people, where I will give you a fresh take on the health and the headlines that you just can't get anywhere else. You know, they don't talk about this stuff the way we do here on Monday, on Medical Monday. All right. So diabetes. Now, you know that diabetes is the #1 cause of kidney failure. And of course, I'm a kidney doctor. And so I see a lot of patients with diabetes, mostly adults. But now the CDC has put out a new report that young people, our youth, ages 12 to 17, that pre-diabetes in young people is on the rise, a significant rise. Let's play this clip talking about the CDC's result with pre-diabetes.
In today's health alert, some alarming news about young people and the risk of developing diabetes. New data from the Centers for Disease Control and Prevention show that 1 in 3 teenagers have pre-diabetes. Our chief health editor, Dr. Parthanandi, here right now to explain what this means and what can be done to prevent this significant threat to young people's health. This is alarming to hear.
Yeah, this is a big wake-up call for parents like myself. The study included teens and preteens aged 12 through 17, and the CDC found that about 8.4 million young people in this age group had prediabetes. That's a big number. This is in 2023 when the latest data was collected. That amounts to 32.7% of the adolescent population in the entire country, and it represents a major increase over previous years. Now, a person, Carolyn, with prediabetes is blood sugar levels that are higher than normal, but not high enough to be diagnosed with type 2 diabetes. However, it is a critical warning sign. Prediabetes increases the risk of developing type 2 diabetes and other serious health conditions like heart disease and stroke.
Wow. So Dr. Nandi, what are the risk factors for prediabetes and what can be done to reduce these numbers?
Yeah, important question, right? So the main risk factors, Carolyn, for diabetes include being overweight, having a parent or sibling with type 2 diabetes, and not getting enough physical activity. That's big. And eating foods high in sugar. So the good news is this, that prediabetes is preventable and reversible by making some simple lifestyle changes. For example, make sure your teenagers Eats a balanced diet, includes fruits, veggies, whole grains, and lean proteins. Also encourage them to stay physically active, at least 150 minutes of moderate exercise per week. Things like walking, cycling, and swimming, it's fun stuff. And losing weight can significantly improve blood sugar levels. These changes, along with regular checkups with your healthcare provider, can help teens reduce the risk of developing type 2 diabetes and improve their overall health. It's not just like, oh, should we do something about it? It is a crisis. It's imperative we look at this stuff and say we need to do it.
All right. Very good. Yeah, that's pretty scary. That's pretty scary. Y'all, if you are surprised by this result, put shocked in the chat if you're shocked. If you're not surprised, just put not surprised. And also in the chat, please tell me some things that you can suggest for people to do with their kids, or that you might do with your own kids to help to decrease the risks for prediabetes and ultimately diabetes in kids. So he mentioned a few things, but what are some things when you think about your own life or your nieces, your kids, your cousins, young people, the kids you teach at Sunday school, the kids you teach at school? What are some things that are going through your brains of what you can do to help to decrease this crisis of prediabetes? So I'm going to come back and ask you some of those, but I want to talk some more about the CDC study. Okay, so yes, the CDC study showed that 1 in 3 teens and preteens ages 12 to 17, 1 in 3 has prediabetes. And you will recall that prediabetes is not actually diabetes yet, but it's a huge warning, okay, and a huge risk factor. What we use to determine if someone has prediabetes is the hemoglobin A1C. So that's not just a snapshot in time of what your blood sugar is or your blood glucose is. The hemoglobin A1C gives us an average of what your blood sugars have been running over the last 3 months. And so I always say when patients come to the office door and they have hemoglobin A1Cs that are high, and they're like, oh, nah, doc, that's just because I had a donut on my way up here. I'm like, nah, boo, that means you've been having donuts for 3 months. This is the average. It's not a snapshot. And so it's pretty reliable, the hemoglobin A1C. The pre-diabetes range for hemoglobin A1C, and I want y'all to check this out, write it down, look at your my charts and see what your hemoglobin A1Cs are. If your hemoglobin A1C is between 5.7 and 6.4, you have pre-diabetes. Okay, between 5.7 and 6.4. You don't have diabetes, but honey, it's a warning sign that you need to do something. And now we're seeing that these young people, ages 12 to 17, more and more of them are having the prediabetes. And just to put it in perspective, there was a CDC report in 2020 that showed that instead of 33% of the teenagers having prediabetes, only 18% had it. I will say, just a kind of full transparency, as someone looking at this from a scientific perspective, we don't have all of the data, okay? And this is just kind of a little peek behind the curtain. For the CDC report that's been released under this current administration, we did not get a chance to see the raw data. In other words, those of us who are looking as doctors, as scientists, have not gotten a chance to really see the full breakdown. Whereas in the previous CDC report, we were able to see the raw data, and so that we could kind of weigh in. The previous study was what they called a peer-reviewed study. I'm talking about the one back in 2020, meaning that physicians, scientists, your peers could look at the study and then weigh in, which of course can make it a stronger study when you have peers to point out the weakness. This current study that was released by the current administration was not peer-reviewed. And so we're all just kind of being forced to take the words of the scientists who've been placed in those positions. And so that being said, there still is more to learn about this story. But the truth of the matter is, we know that prediabetes has in general been on the rise, and it's something that we need to look out for in our kids. So has anyone said anything that they might do to try to help to decrease the risk of prediabetes in their teens or in their kids?
Yes.
Okay.
Kendi K, hello.
Hi, Kendi K.
She says, not surprised about these numbers, but just water infused with cucumbers and lemons, and not the packets and dyes, and then of course no sodas.
Very good. Very good. And I like that because you're mentioning a fun way to do water. The bottom line is, right, water instead of the sugary drinks, the sodas, even fruit juices. Yeah, we think, oh, fruit juice, orange juice, cranberry juice, that's healthy, loaded with sugar, right? But I like the way that you're talking about presenting not just water to kids, because, you know, kids in the summertime might roll their eyes at plain water. But if you infuse it with these things like cucumber, mint, lemon, things of that nature, it might be more appetizing to kids and adults. And so that's a really good idea. And yes, try to avoid those sodas. That's good. That's a plan.
Yes. Barbara, hello. Barbara says, make meals focus around fruits, veggies, and lean meats.
Very good. Very good. There was a time, I guess, depending on where you were raised, if you were raised in the South, where you would think, depending, maybe it's a cultural thing, that if you don't have meat on the plate, a big old slab of meat and some potatoes, then it's not a meal. But if you're focusing, like what you're saying, on having fruits and veggies, let them be 3/4 of the plate. Eat the rainbow, right? Where you have your leafy greens, which are filled with chlorophyll, and that's a natural way for the body to detoxify the liver and the kidneys. Where you have just the different colored, even fruits, okay? Your blueberries, your raspberries, your strawberries, where you have root vegetables like beets, carrots, all of these things. And you don't have to have meat. If you eat meat, wonderful. But if you eat meat, try to have lean meats, right? Like have a chicken, white meat chicken, grilled, baked, not fried, preferably no skin, or have certain fish like fatty fish loaded with omega-3, salmon, halibut, mackerel. But yes, really let the star of the show be the fruits and the vegetables and encourage that. Do it yourself and let your children see that so that it becomes a norm. Good idea. I like it. I like it because diabetes type 2 is something that's actually preventable in many cases, especially when you start with young kids. In some cases, it's not, but in most cases, diabetes type 2 is preventable. And some of the things that put you at risk for type 2 diabetes, living with obesity, having diets that are high in ultra processed foods, in drinking a bunch of sugary drinks, having a lot of carbs, fatty foods, as opposed to lean. Real good. I like this. Come on to the front of the class.
Miss Denise, hello.
Hi, Miss Denise.
She says lifestyle changes, especially eating healthy foods, no fast food.
Very good. And that's tricky, especially if you're on the run. Like I mentioned, I'm always doing basketball games and traveling. It's really tough to avoid fast food, right? But if you do planning, do meal prep, things of that nature, and really try to cook as much as you can and make healthy choices, that's good. That's good. And so what we're talking about is trying to prevent pre-diabetes, which can lead to type 2 diabetes. But I do want to touch on type 2 diabetes versus type 1 diabetes. And I will give that explanation because there's something else that's occurring that's pretty cool, actually, in its representation by a Barbie doll that has type 1 diabetes. So first, let's talk about the difference between type 1 diabetes and type 2 diabetes. Again, pre-diabetes, if you pull that back, then you can perhaps prevent having type 2 diabetes. So, okay, what is diabetes? Diabetes is when you have high sugar in the blood, high blood sugar, hyperglycemia. And what happens is we all have insulin. Insulin is a hormone that's made by the pancreas. And your insulin acts like a key that unlocks your cells to let sugar in, because every cell needs sugar or glucose to survive, okay? And so your insulin is the key that unlocks the door of the cell to let sugar in. If you don't have enough keys, if you don't have enough insulin, then you can't unlock the door. The sugar cannot get into the cells. So where's the sugar? It stays in the blood, high blood sugar, okay? So in type 1 diabetes, which has been called juvenile diabetes, you're not making enough insulin. You don't have enough keys. And so you simply cannot open the door. You have high blood sugar. Now, unfortunately, with type 1 diabetes, that's not one that we can prevent. Okay. That's difficult. That's typically more of a genetic thing, and children will have type 1 diabetes. It's the type, and adults can get it too, of course. Type 2 diabetes is by far the most common form of diabetes. So when we're talking about diabetes in this country, then 90% of the time we're talking about type 2 diabetes. Now, for that, you might have a lot of insulin. You might have all kinds of keys. The problem is the keys don't work. And so you have a bunch of keys here, keys there, keys everywhere, but they don't work. And so they can't unlock the cell. And so you still can't get the sugar inside of the cells. And so you still have high blood sugar or hyperglycemia. Okay. So type 1 diabetes, which is the juvenile diabetes, you don't make enough keys. Okay. And that's not one that we can really prevent. We can treat it. We can manage it. We can't really prevent it. It's more genetic, familial, autoimmune. But for type 2 diabetes, you might have all kinds of keys, a lot of insulin, but you're insulin resistant. the doors to the cells are resistant from working with your keys. And so either way, you still get high blood sugar. Okay. So yeah. And if for type 2 diabetes, just some of the risk factors, living with obesity, and again, ultra processed foods, sedentary lifestyle, things of that nature. So I like the advice y'all gave. So yes, for our kids, for adults too, as far as preventing type 2 diabetes. But now let's talk a little bit about the type 1 diabetes that more just depends on the luck of the draw. And this is the one that's more genetic, and some kids are just born with not enough insulin being produced. Well, now Barbie by Mattel has representation when it comes to dolls, and they have a new Barbie doll that has type 1 diabetes. Let's play that clip, Shador.
After more than 6 decades of Barbie, there's no question the beloved doll can do it all. She rocks different hairstyles, explores countless careers, and celebrates different backgrounds. Express yourself. And this week, doll maker Mattel is expanding her repertoire, introducing the first Barbie doll with type 1 diabetes. After past criticism over Barbie's early lack of diversity, Mattel says it marks an important step in our commitment to inclusivity and enables more children to see themselves reflected in Barbie. Children like Eloise.
I've always wanted a Barbie just like me that has a pump like me and a Dexcom like me.
Reactions already pouring in.
She's just like me.
Mattel worked with nonprofit Breakthrough T1D to develop the doll.
You got the chance to give some kids the Barbie, and what was their reaction?
It was amazing, the moment that we unveiled Barbie. The screams, the shrieks, the joy was extraordinary. Frankly, the tears, I was crying. The kids were crying. Then they started chanting, Barbie, Barbie, Barbie.
4-year-old Cora Patel showed us her continuous glucose monitor.
What does it do?
Make me healthy.
Just like Barbie's.
What do y'all think about that? I love it. I love it. I love it. Do you think it makes any difference with little kids seeing, like little kids with chronic illnesses like diabetes, type 1 diabetes? Does it make any difference in them seeing a doll that looks like them? In the big picture, are we doing too much? Are we in the woke culture, as certain people have tried to take that term and make it into a negative instead of being the positive that it was intended to be? Is it too much? Is it no big deal? Does it move you one way or the other? Or do you think that representation is important for Barbie dolls? And I'll tell you, listen, now I never was a big Barbie person, but my big sister, Jetty Lou, was heavily into Barbie. I mean, she had the Barbie mansion, Barbie, whatever, pink Cadillac, whatever kind of car it was. She had Ken. And even years ago, when she was a child, she wrote a letter to Mattel because she felt like there should be a Black Barbie. So this gets into representation. And don't you know that not too many years later, we had the Christie doll, okay? We had a Black Barbie. Jetty didn't start there. She wrote and said there needed to be a Black Ken doll. They made a Black Ken doll eventually. Now, the Black Ken doll had this little old tight, funny-looking hairdo, and he had features that, anyway, but they tried. The point is representation does matter. And my very precocious young sister even recognized that the way the Barbie dolls originally looked, that wasn't how we looked. And so children need to see themselves. It helps to build self-esteem. So comment and let me know what y'all think about it. Does that make much of a difference?
We had a few people chimed in already.
Okay.
Beautiful you. Hello.
How beautiful you.
She says our kids don't need a sick doll. Really? So
they don't need a what? A sick doll?
Does not need a sick doll.
Well, see, that's interesting that you say that our kids don't need a sick doll, because when a person has diabetes type 1, and, you know, for those of you who are new to me, yes, I practice nephrology now, kidney disease, but I also have been board certified in pediatrics. And I did my training at Georgetown. I did a dual residency, internal medicine and pediatrics. And so, of course, I took care of a lot of the children who had diabetes, who had pumps. And those children, yes, though they have a chronic illness, they live normal lives to the best of their abilities. And so they play sports, and they might have an insulin pump that's attached to them. And they might feel strange or weird because other kids who don't have diabetes don't have those pumps. Those same children, I remember my kids, my twins have a classmate who would have to go to the nurse's office to have her blood sugar checked so she can get insulin with her meals. She's a girl who plays sports, very smart girl, advanced classes, just plays tennis, normal girl who happens to have a chronic illness. And so when you think about human children, they are not just, that's just a sick person over there. This is their lives. It's normal for them, but unless they see themselves and other people, then they could feel weird. And so I look at it as more as, we don't need a sick doll. That's easy to say if you're someone who's not living with something that makes you look different as a child. And so it's not just a matter of, we don't need a sick doll. This is the lives of some children, and they're not weird. They're not abnormal. They're not strange. What this does is it helps to normalize something that they were just born with that's not their fault. And so I strongly disagree in you saying we don't need a sick doll. I think we do need representation, and we need to do everything that we can to build children's self-esteem, especially when it comes to health, into something that's not their fault at all. Yeah. But thank you for sharing your thoughts.
Absolutely. Marina, hello.
Hi, Marina.
This absolutely makes a difference.
I agree. And, another company that was good at doing this was the American Girl doll. Look, my daughter grew out of it, but she had so many American Girl dolls. Not my young girl. Avery wasn't worried about it, but my oldest girl. And of course, they had dolls of every culture, every creed. They had Black dolls. They had Asian dolls. They had Native American dolls. They had all kinds of dolls, and each one would have a story in a book that was culturally significant. Okay. And guess what? They had some American Girl dolls who were in wheelchairs. Okay. They had some American Girl dolls who sometimes, if they got hurt, they would have a cast on. And then one time we went to New York City. Child, this is too much. What do we do for our kids? There was actually an American Girl doll hospital. And again, back when I was doing my residency, some children with chronic illnesses are in the hospital, for huge months of their lives, right? If they have sickle cell disease, if they have cystic fibrosis, if they have leukemia or other forms of cancer, being in the hospital is their norm. And so for those kids to go to the American Girl doll store and to pop by the hospital and see that the whole world is not normal and perfect with all of their arms, legs, and walking, to see themselves, representation matters. Yeah.
Tisha.
Hi, Tisha.
Teacher says, I think it's a great idea, especially for children who have just been diagnosed. It may empower them to be okay with their new way of life.
Absolutely. And to have a little friend in a doll, right? To maybe feel a little less alone. I agree. Yeah. I think unless you're a person who's empathetic or willing to step outside of yourself, maybe sometimes it's hard to see these things, but there's a whole world that's outside of any of us or our own experiences, and anything that helps to build the self-esteem of a child. Hey, I'm with it. All right. Real good. All right. So hooray to you, Mattel and Barbie, for that notion. All right. Y'all, make sure you please give us a like. We're talking evidence-based medicine. Honey, we got all kinds of opinions from left to the right. And make sure you join the membership if you want to have a members only live Q&A where you get a chance to access me and all the reading I do. Listen, I read journals, medical journals, every single day of my life. I'm not even exaggerating or kidding. And so in the live Q&As for members only, that's your chance to ask me questions about your health, and I'll give you medical information based on your questions. And again, make sure that after we're finished with this live, click the link in the description, or just go right here on my Dr. Frita channel and look at my Truth Talks segment. It aired on Friday, on July 11, where we talk about the rise and fall of Diddy, and I'll talk about the medical mystery, including Kim Porter. I'll be sure, honey, we talk about a lot. It's a good episode. All right. So that's a good episode, but let me tell you what was not a good episode, Shador.
Mm-hmm.
Fire chief in Maryland. We have a new fire chief in Prince George's County, and she was up in front of the good people, right before 4th of July weekend, and she fell out, Shador. She passed out. Her name is Thelmetria Michaelides. Please forgive me if I mispronounce your name. Meme is what they say is her nickname. Her first name is Thelmetria. So let's play this clip. And as we play this clip, I want you all to answer in the chat, what are some of the do's and don'ts to do? What are some of the do's and don'ts on action if you see someone pass out? Do's and don'ts. Okay, let's play this.
If you see fireworks, go get the medic.
right. That was fast, just like that. It's hot. It's July. She has a brand new position, a lot of pressure, probably. You know, she apparently is just, you know, a highly qualified person. She was the first Black female in Maryland to be a bomb squad technician. And so she is a trailblazer in a lot of ways. And now she's the new fire chief. But did anyone in that short little time, look, I know that clip was quick, anyone put any do's and don'ts? What should you do if you see someone faint? What should you not do? Any do's and don'ts? And I'll run through them, so don't worry.
Not yet.
Okay. So one thing to do, if someone falls off in their faint, you make sure, you know, they're in a safe place, but you leave them flat. You don't try to sit them up. I noticed that a lot of people will do that. If someone falls and passes out, oh, sit them up, see, make her stand up or sit her in a chair. No. When a person passes out or they have syncope, fainting, then the body is telling them that the brain needs more perfusion, more blood flow, if it's a fainting spell, if it's syncope. And so you want to not only leave them flat on the floor, but you want to lift their feet up about 12 inches above the heart so you can increase the blood flow to the brain. That's if it's a fainting spell, okay? So you do not want to sit them up quickly, okay? Another thing that you want to do is see if they're arousable. Can you wake them up? If it's just a syncope or just a quick fainting, they'll fall out and they still will be like, hey, oh, what happened? They'll be responsive. So you want to make sure they're responsive. And if they're talking or if they're moving around, then you know that, hey, they're breathing and they likely have a heart rate. If they're unconscious, then you do want to, yes, try to wake them up, but you want to try to check and see if they have a pulse, check to see if they're breathing. And certainly if they're not breathing, if they're unresponsive, you do want to have someone to call 911, okay, or activate the emergency medical response team. And you do want to start CPR. Now, even if you're not certified in CPR, that's okay. You can do a chest compression only CPR. We talk about it all the time. And you can Google it, American Heart Association, or go to heart.org, or just Google compression only CPR. And that's a way that you can do chest compressions and start with CPR as 911 is being called. The other thing you want to do is if they're not responsive, not breathing, no pulse, you do want to have someone to grab an AED, automated external defibrillator, and start making it a habit, please. When you go places, look around look at the walls, look and see where the AED is, so you just know where it is. And you don't have to be a neurosurgeon to be able to use the AED. It's broken down in layman's terms so that people can use it, and it will talk you through how to put the pads on a person's bare chest so that if you need to, you can give them an electrical shock, and you don't have to make any decisions. You put the pads on, you read, and the AED will put the heart rhythm up there. Don't worry, you don't have to interpret it. It will interpret it, and it will tell you shock now and tell you what button to press. Do not be intimidated. The AEDs are made for lay people. The other thing that you do not want to do not give a person who's unconscious or who has altered mental status or confused, don't try to give them anything to drink. You might make them choke or aspirate. Just leave it alone until they are fully awake and aware. So there's a couple of things. So if she just had syncope or fainting, then most commonly it's due to a vasovagal reaction, meaning she could have had nerves, okay, being up there in front of all those people, a lot of pressure, new position, and it could have caused her to have a drop in her blood pressure, slowing of her heart rate, and made her faint, okay? She also could have been running around and not drinking. It's July, it's hot. So she could have been dehydrated, which can lead to a low blood pressure and make you faint, okay? So there's different reasons if she just had a syncopal episode or fainting. It's a whole nother story if she fell out, which I don't believe is the case for her. But for people who fall out from cardiac arrest, those are the ones who will be unresponsive, no pulse, no breathing. And that leads you down the other trail of 911 AED. But make sure you check out videos here, right here on the Dr. Frita channel. I have a video on cardiac arrest versus heart attack, and I also have several videos and short form content where I talk about what to do if someone is fainting. So congratulations to the new fire chief, certainly wishing her the best. But as always, with all the headlines, we take advantage here and we use it as a point of education so we can live our healthiest, happiest lives. Yeah. All right, y'all go ahead and give us a like as we move on to the next thing, Anyone have any comments on this particular story?
Yes, Tijuana, Facebook. Hello. She says, I live in PG County, and that was sad to see. But the last I saw her thanking her team for taking such good care of her until she got to the hospital.
I saw that. I saw her thanking them. And so, I don't know her details, of course, but it does feel like it was more likely than not a syncopal episode. But yeah, Prince George's County. Listen, now, I used to live in DC. I know about Prince George's County. I know who all lives there and who's running the city. Okay, Prince George's County. Okay.
Takesha. Hello, Takesha.
Hi, Takesha.
She said if the person is alert or conscious, keep asking them questions to learn of any medical issues.
That's good. That's smart. That's very good, because then that will be helpful if they pass that back out again, right? You'll find out, okay, did you eat breakfast? Okay, have you had anything to drink? Do you have diabetes? Do you have any heart disease? That's very smart. While they are alert, ask the questions. So if something happens and they go out again, you'll at least have some information to give to the paramedics. I like that one. That's a smart one. Oh, you come on to the front of the class. Come on.
And Miss Aileen, hello.
Hi, Miss Aileen.
She says, if conscious, use a cool cloth on their forehead.
That can help. Okay, so say the reason that they've passed out is because they're overheated. And we talked earlier in one of these conversations about people who have heat-related illnesses, heat rash, heat cramps. If they have heat stroke, heat exhaustion, then if they're overheated, then putting cool cloths on them, then that can be helpful as well if overheating is a reason. Yeah, so that's good. Okay.
All right.
Good. All right. So now, shall we talk about NeNe Leakes? I feel like NeNe Leakes stays in the headlines. I do like this part right here, though. She actually has been openly talking about her son's health issues, which I know is helping other people, because her son, Brentt, whom we watched grow up on Real Housewives of Atlanta, I'm talking about her youngest son. Her youngest son literally had a stroke and heart failure diagnosed when he was about 23. By the time she shared it with us, I know he was 23. He may have even had symptoms at the age of 22. And then fast forward, by the age of 25, he had to have a heart transplant. And let's just pull up just the regular picture of Brentt with NeNe Leakes, if you're able to. So that y'all remember Brentt. So she and Greg Leakes had Brentt, and we saw him even when he was a little smart, little cute boy. Now he's grown up. He's taller than NeNe, and y'all know NeNe's not short. And yeah, he did end up having, like I said, the high blood pressure, severe high blood pressure, as they describe it, and heart failure. And we know that heart failure is when your heart is not pumping adequately enough. And so you can get a backup of fluid in the lungs. You can get swelling in the legs and the feet. You might not be able to lie down and breathe well. You might have to sleep on several pillows or sleep sitting up if you're having heart failure, congestive heart failure. And high blood pressure is a big risk factor for having heart failure. Well, if the heart failure gets to the point where it's severe, then you might actually need a heart transplant, which is what Brentt had. Okay. And I have a photo here of when he was actually in the hospital after having the heart transplant. And, I think he was there at 14 days at that point. And then he started kind of walking, and he had to relearn pretty much how to get his muscle strength back. And he actually lost 100 pounds. Okay. And we know that living with obesity is a risk factor for high blood pressure and heart failure, for that matter. He had lost 100 pounds. And even after he lost those 100 pounds, now he wasn't underweight. So that means that he was really living with quite a bit of extra weight. But he had the heart transplant. He was doing well. NeNe shared that story. Well, now fast forward, NeNe is sharing what's going on with Brentt now. Just recently, he's had to be hospitalized again because the heart transplant is showing signs of rejection. Let's play that clip, please, Shador.
Okay. Is it the YouTube one or the IG one, Dr. Frita?
Oh gosh, the YouTube one.
Got a new heart in.
Actually, no, I'm sorry. It's the IG one. My bad. But that was him as he was waking up after having the heart transplant the first time. But now I want to play where NeNe Leakes is talking about his actual, what's going on now, the rejection.
You were asked to come back you were asked to do traders.
Yes, I was asked to do training.
And then we heard that you were not doing it. Yeah. Why did you choose not to do it?
So I was asked to do traders. I was really excited about doing it, by the way.
Yeah, we talked about it, but it wasn't public at that time.
Is it public now?
It
Yeah.
is. It
Oh,
is
because they
because
set the cast.
yeah, because I think
Okay.
since you didn't do it, I think they took Portia.
It was Portia and Tamar.
Oh, it was always those two.
No, I don't know.
Okay,
I
you
don't
don't
know
know.
because they did not reveal to me who the cast was going to be.
Yeah, and Portia didn't tell me either, so I was like, maybe she replaced
so
you.
I kind of felt like they did get Portia.
Okay.
Yeah, but I'm not 100% sure.
Yeah. Okay.
So,
but why didn't you do it?
I couldn't do Traders because my son's in the hospital, and he's still in the hospital. And so my son's been in the hospital since May, like early May.
When I shot the NeNe Leakes show with you, I felt like Brentt went in then.
No,
or maybe he was already there.
He was already there.
Okay, wow, that's
he's been there about 2 months.
How's he
almost.
doing?
He's doing a lot better. He's turned a curve. He has a little while longer to be there, but he's turned a curve.
Okay, and Crystal.
Yeah, I want to
don't
be
know if you know
sensitive because I don't.
Can you tell her what Brit is dealing with? If you
Okay,
mind, 'cause she
so
doesn't,
Brent,
and our fans may not
when my
know.
husband died, we only had one son, which is my son Brent. And at 22, he had a stroke and a heart attack. And from the stroke, his heart was weak and it never got back strong. So he needed a heart transplant. So he's had a heart transplant since then. And what's happening now is his heart started rejecting. And so they are now trying to stop the rejection.
I see.
Yeah.
Wow,
so
that's a lot.
Yeah. I'm real proud of NeNe because, she has all these things going on. She had, the controversy, of course, with Bravo and NBC Universal. It looks like they're working through that since she's been offered to be on shows. She's, always in the limelight, always kind of having to be on, hair, makeup, humor, wit, on. And all this time, she's going through her baby, her youngest son, facing a real life challenge. Because just think about it. If anyone in the chat, if you know someone or know of someone who's had a heart transplant, then put it in there. Put heart transplant. And I don't suspect that we're going to find a lot because it's just not that common. It's not that common. And so she's sitting there, almost her son against the world, dealing with all of that while she's there in glam working, because NeNe has shared she is she's the financial backbone for her family in a lot of ways, plus the emotional and support backbone. And so she's dealing with all of that while her baby is having a heart that's being rejected. And so just in general, just in talking about transplants. So we talk about kidney transplants, right? Because you can have a living donor, someone who's alive, give you one kidney and they can still live and do great with their other kidney, because that kidney, they won't be stuck with half their kidney function. That kidney will bulk up and do the work of 2 kidneys, okay? Liver transplants. Not only can you get a liver transplant for someone who's passed away, you can be a living liver transplant. Give someone a little piece of your liver, and then guess what? Your liver will regenerate. You'll grow back your full liver, and the liver you gave them will grow and get bigger, okay? So we know about different transplants like that, lung transplants as well. The heart transplant, that's not a matter of giving someone a little piece of a heart, or, hey, you have half my heart and I'll keep it. That is just a very serious situation. And, the risk of mortality and certainly morbidity, the risk of passing away or rejecting, it's high. It's high. Because what happens when you get a heart transplant, as Brentt did, you literally are getting someone else's heart in your body. And because it's not your heart, it is foreign to your body. So what happens? What does our body do when foreign objects come, when bacteria come, when viruses, when objects from the outside world? Well, our immune system kicks in and we try to reject that thing, right? We try to get rid of whatever this foreign object is coming and invading our body, including a heart transplant. That's why transplant patients take medications to help to suppress or to push their immune systems down so that you don't fight the organ. But what happens while you're on those medicines that are trying to push your immune system down, it's telling your antibodies to be quiet so you don't reject? Well, now you're at risk for infections because you're telling the antibodies to be quiet so they don't reject the heart, but those antibodies then also have to be quiet, and that means that they're not protecting you the way that they should from bacteria, from viruses, okay, from different fungi. So you can be at risk for infections. And what happens, and this is what we deal with, especially, for me personally, dealing with my patients with kidney transplants. Sometimes they'll be on a great dose and we have them so they're not rejecting the kidney. But then if they get sick and they get pneumonia, we have to back off of some of those medicines so we can build up their immune system. And in building up their immune system, well, now they're at risk for rejecting the organ. And so it's a very tricky and tedious tightrope game that you play. And I just am really praying that Brentt pulls through and does well. And I'm praying for NeNe, because I feel like all we see is strong NeNe, witty, telling them off. I'm, superwoman. But that is her baby who is sick. And she just lost her husband not so long ago. That's a lot that she deals with. And, including social media, everyone critiquing. Yes, she gets a lot of compliments. She gets a lot of critique also. So if anyone has any questions about transplants in general, then I'll answer them. Also, we could talk a little bit about strokes, because again, he's not an older person. He's a young, I say kid. I know he's an adult, but he was only like 22, having stroke, having heart attack. Just, remember risk factors for stroke: high blood pressure, high cholesterol, living with obesity, sedentary lifestyle. In some young people, we know that the numbers of strokes in people less than 45 has increased significantly over the last decade. Sometimes you can have a defect or something abnormal in your heart, a hole in the heart where a clot goes from one side of the heart to the other and goes to the brain. And we talked about that here on Medical Mondays. So just making sure that you look out for the symptoms of a stroke. And remember, B, fast. Okay. B for balance. Okay. If your balance is off. E for eye problems, if you're having blurry vision. F for facial droop. Okay. Or weakness. A for arm weakness or leg weakness. S for slurred speech. And if you have these things, it's T, time to call 911. Don't ignore those symptoms. And of course, right here on this Dr. Frita YouTube channel, where we have over 880,000 subscribers. Thank you, y'all. I have videos on strokes, stroke symptoms. I have videos on congestive heart failure. I have videos on high blood pressure. Oh gosh, I have videos on that out of the yin yang. Plus, I have my book on high blood pressure, Under Pressure, a guide to controlling high blood pressure, where I talk to you about managing your blood pressure, not just with medications, but also with holistic medicine, natural medicine, integrative medicine. Okay. So make sure you can click the link in the description or go to my one-stop shop, drfrita.com, and you can check out this book, Under Pressure, a guide to controlling high blood pressure. But again, wishing all warm wishes and prayers that Brentt does well, and that NeNe understands that it's okay to not be strong all the time. And I just really hope that she leans on whatever support she has, and that she just allows herself to feel and to not feel like she just has to be superwoman, because I'm worried that that stress could get to her and affect her health. Oh my goodness. Oh gosh. All right. Anyone have any comments as we get ready to close this thing on down, Shador?
No, ma'am.
All right. All right. So we've talked about a lot today, right? We talked about myth versus fact with Venus Williams. We've talked about the diabetes, prediabetes in teens being on the rise. Now 33% of young adults ages 12 to 17 with prediabetes. We also talked about type 1 versus type 2 diabetes. We talked about that Barbie. We talked about the fire chief, Prince George's County. And one of the people in our chat, hey there, is from Prince George's County, and how it looks like she had a syncable or fainting episode. So what to do, what not to do. And of course, NeNe Leakes with her son having the heart transplant, and having lived through stroke, heart failure, heart attack, all of those things. Now let's do a quick run for a 5-minute health check. Make sure you give us a like, give us a share, and click the link in the description here, or just stay here on my YouTube channel when you finish here and watch me on the episode of Truth Talks Live. Okay. And please comment in the chat. Tell them Dr. Frita sent you. Okay. Please do that. All right. What do we have, Shador? What's our 5-minute health check? What we got?
Measles surge is back 3 decades later.
I'm fixing to go, Shador. Now, we thought we had eradicated measles, but now with all of the misinformation largely being given by RFK Jr., we have a decrease in measles vaccines being given, and surprise, surprise, we have an increase in measles. Can you believe that right here in 2025, we now have more measles cases than we've had in 30 years? There's a direct correlation. So please make sure that you are consulting with your doctor, that you're up to date on your measles vaccine, and that you get your kids vaccinated. Of course, it's your choice. But make sure that if you're making decisions, you're making them based on the evidence. Okay. Measles is not a disease that's just, a few bumps or a little rash or a little fever. Measles can make you unalive. We've had at least 3 deaths already. Okay. of measles cases this year. And the outbreak has been in over 14 states. And most of the people who are getting these measles, these life-threatening measles, are not vaccinated. So make sure you use your own good common sense. You talk to physicians you trust, consult with your physician, and get the facts. Get the facts about vaccines because they do save lives.
Ritz recall peanut butter crackers masquerade as cheese crackers.
Y'all tried it, because let me tell you something. My oldest child, Amara, lives off of Ritz peanut butter crackers. I'm gonna tell y'all right there. Look, I don't have any endorsements from Ritz, but maybe I should, because that girl eats Ritz peanut butter crackers so much. So this is what happened. The label has said that they have cheese crackers, but they've mislabeled some of these peanut butter crackers. Well, we know that peanuts are like a great source of allergy. A lot of people are allergic to peanuts. And so you can imagine if you're someone who's packing your kids' lunch and you just grab what you think are cheese Ritz and they're peanut butter Ritz and you send your child to school, you can have your child in an anaphylactic reaction. You know what anaphylaxis is? Hey, check out our last YouTube live here, our Medical Mondays. We went deeply into anaphylactic reaction. We talked about Sunny Hostin and how she had an allergic reaction to walnuts. Okay, we get into details there. Anyway, but just make sure if you are someone who has some Ritz crackers that are labeled as cheese, especially if you're dealing with someone with a peanut allergy, just toss them. Just toss them and keep up to date online with where the recall is and where Ritz is as far as the safety and the mislabeling. So yeah, that could be dangerous.
All right. When natural isn't safe, how turmeric pills lead to severe liver problems.
Now this one upsets me. It upsets me because, anyone who's taking supplements, well, you're trying to do the right thing. You're trying to do the right thing and be healthy. But what I tell patients, and Shador, you hear me tell patients this in the office all the time, because supplements are not FDA approved, right? We don't know exactly what's in them. They can have proprietary blends, meaning like, secret blends that they don't have to tell us. Then it's difficult as physicians for us to tell you which supplements are safe for you or how much, because again, it's not FDA approved. Now, turmeric is something, you've heard me talk about it, that can be very great for you. It's anti-inflammatory. I love to actually get organic turmeric and put it in my juices, put it in my smoothies. It's good for inflammation, good for, breaking down antioxidants in your body. Very, very good. But for this particular person, she was taking the turmeric supplements in such high doses that it actually became toxic to her liver and started causing signs of liver failure. And so make sure that when you talk to your doctors and they say, hey, what medicines are you taking? Don't just give them the prescription medicines, tell them what supplements. And what I do is I have my patients to bring the supplements. And if it's something where I really can't verify or I can't know or it's not FDA approved, then I'll have to give a disclaimer. I can't guarantee you that this supplement is safe. And because in this case, you could be taking something that's too much, more than what's recommended. So consult with your doctor about what dose would be safe for you. And the more you're able to get supplementation in natural manners, like getting fresh turmeric itself, then that's going to be even better. Yeah, that's a tough one. All right. Well, let's wrap this thing on up. I thank you to everyone who has joined us here for this Medical Monday where we talk about celebrity health news. Make sure you give us a like on your way out the door. Share this video with the people you care about. Don't forget to watch me on @TruthTalksLive. We have the link in the description. Also right here on my YouTube channel. You just click that thing. If you just want to see me, then fast forward to 25 minutes, but the whole episode is good. We talk about the rise and fall of Diddy. I specifically talk about the medical aspects and comment on there that Dr. Frita sent you, please. And for all things Dr. Frita, make sure you go to my one-stop shop, drfrita.com. I talk to you about my favorite things, like my favorite blood pressure cuffs I use, my favorite juicer, my NAMA juicer, where I give you a discount code if you're interested in that. And I've got some videos coming out. Oh, hey, for members, you'll get a first peek at the video I have coming out. Everyone else, I have something coming out at the end of the week, a video that I think is pretty exciting. La, la, la. Thank you so much, Shador.
Dr. Frita, wait, before we close out, I want to give a shout out to Beverly, who gave you a shout out.
Oh.
Hi, Beverly. She says, Dr. Frita, you're the best and a great deal of health issues. Thank you so much for your caring information.
Thank you, Beverly. Oh, thank you, Beverly. I appreciate that. I appreciate the feedback. And in case you can't tell, I love medicine. And more importantly, I love sharing information that I believe will help my people. And so I appreciate you for that feedback. Please make sure you share this information to other people who you think will get the same things out of the information that I share. Thank you, Beverly. That's nice. All right. I appreciate y'all. We'll see y'all back here next Monday, same bad time, same bad place. And thank you for making Monday your healthiest day of the week.